So I wanted to do a quick video about quercetin and the fact that it basically reduces the body's ability to metabolize caffeine, resulting in extra caffeine being in the blood for longer periods of time. And now people may remember I made videos about this in the past. What brought me to taking quercetin? Well, years back, I was put on a drug called metoprolol, and I was put on aspirin for what was thought to be severe tachycardia and possible atrial fibrillation. So I was put on aspirin and something called metoprolol, which is a beta blocker. Now, this caused sinusitis, sinus polyps, and asthma, which was almost misdiagnosed by my family doctor as pulmonary fibrosis. Now, pulmonary fibrosis is more or less a death sentence. So I wanted to find out what I could do about pulmonary fibrosis. At that same time, my karate instructor had a friend that had two children that suffered from cystic fibrosis. So I was already researching different diseases that caused fibrosis of the tissues, particularly of the lungs. So this was prior to this. Now, my asthma, because I was diagnosed with asthma, but it was so severe. Now I do an hour easy of vigorous cardio a day, but this asthma that I had was so severe that I couldn't even walk like 15 feet. I'd walk up steps, I'd be winded. I thought I was dying. Like, I really thought I was dying. And this was in conjunction with tachycardic episodes. So it was like the metoprolol wasn't really doing much, but I was getting really heavy side effects from the metoprolol, which did subside after I started supplementing with high dose quercetin. Now, I want to be clear before I continue with this video. I'm not a doctor. I'm not a medical professional. I'm not a nutritionist. I'm not a dietitian. I'm not anything like that. So what got me to start supplementing with quercetin was this crazy, since I was like 35, my health had I started falling apart, like seriously falling apart. I went from being extremely healthy to extremely unhealthy. Okay. And I do trace it primarily to my experimentation with the starch solution, Dr. McDougall's starch solution, which caused me to gain quite a bit of weight quite quickly. But I don't think that was all that it was, because I was also dealing with a lot of stress and things like that. But my breathing ability went down. I developed tachycardic events and things like that. So once I got really ill and I couldn't breathe well and things like that, and I developed asthma, I started looking at what can I do, because my family doctor had said it could be pulmonary fibrosis. Now, of course, I went to a pulmonologist immediately to rule out pulmonary fibrosis. But prior to getting it ruled out with a scan, what I had done is I had looked into what works for pulmonary fibrosis. And quercetin does seem to have a good effect at reversing pulmonary fibrosis and other forms of fibrosis. What I did discover is, of course, I had plenty of friends that were gerontologists. Now, what it is the disease, a lot of diseases like pulmonary fibrosis, diabetes, a lot of these diseases are, in fact, accelerated senescence, accelerated aging of certain systems of the body. Quercetin is a powerful anti-senescent. It's a powerful geroprotector. So that was what makes quercetin so effective at healing these issues, protecting the heart, protecting the lungs, protecting the brain, protecting the systems of the body. It regenerates fibroblasts in the skin, so it helps to reverse the aging of the skin. It helps to do a lot to help with basically reversing the aging process. A lot of people like to tout quercetin, I'm not quercetin, they like to tout resveratrol, resveratrol, resveratrol. I'll be honest, I was taking resveratrol for years. I didn't notice much difference. I started taking quercetin and I noticed the difference immediately. So I will say that. Now, the downside of quercetin, which I didn't know because I had already had to take caffeine out of my diet for the simple fact that I had, my cardiologist told me he didn't want me drinking anything caffeinated or anything like that. So I had already taken caffeine out of my diet. So that was not a big deal. But what I found out upon researching quercetin is that quercetin basically reduces the body's ability to metabolize caffeine. So you will have a higher level of caffeine in your system for longer. So it slows your metabolism of caffeine, which could lead to caffeine-related side effects, especially if you continue to drink high amounts of caffeine on quercetin. Now, I wouldn't say give up caffeine entirely, but remember, I'm not a doctor. But what I would say is lower your caffeine intake. Switch to decaffeinated coffee. Switch to maybe a lower caffeinated cola. Switch to perhaps cocoa instead of coffee, which has its own myriad of health benefits. I've covered that in my superfoods series of videos. Now, that's what I would say is limit your caffeine to the bare minimum. And do it, make sure that you're doing this prior to starting quercetin, most likely, because you don't want to get any surprises supplementing with high-dose quercetin. Now, how much quercetin do I take? Well, I take about 2 grams of quercetin in separate doses. I take 1 dose in the morning and 1 dose before bed. And that seems to be a high enough dose that I'm getting the maximum benefits from the quercetin. And it's because of my size. I'm about 190 pounds. So that does help me to get the maximum benefit from the quercetin without overdoing it or underdoing it. And so what I'm explaining in this video is, if you haven't already taken caffeine out of your diet and you want to start utilizing quercetin for its health benefits, and I want to make sure people understand, there will be links in the description about quercetin's benefits to things like pulmonary fibrosis, its benefits to things like cystic fibrosis, its benefits for asthma, its benefits for allergies, it's a powerful antihistamine, its benefits for a number of different issues. Also, another thing about quercetin is vitamin C helps with the bioavailability of quercetin. Quercetin on itself is not very bioavailable, so you need to take it with something like lecithin, a vitamin C, or with something like bromelain, which is from pineapple. It helps to digest the quercetin and make it more bioavailable. So don't forget that either, that you do need to ingest it with something to help you absorb it. Or it won't be absorbed well and you won't be getting the maximum benefit from the quercetin. But that's as simple as taking a vitamin C tablet along with your quercetin. And that's all for this video.